Well, hello, it is that time again. So we are having, I'm very excited that Life's Co-Pilot gets a chance to host this great panel. Today it's a speech and hearing month for May. So we've got speech and hearing specialists and experts here today. So we're going to start going through that. So I want to introduce everybody. Dr. Judy, you're big on my screen right now, so I'll let you start. So tell me who you are, tell me your company, a little bit of what you guys do there, and we'll go from there.
Hey, I'm Dr. Judy Olsen. I've been an audiologist for 21 years. I have lived in California and came back here about 11 years ago, and I worked for some different hospitals and organizations. And about 2.5 years ago, I decided to go ahead and open up my own private practice again. And we have almost five locations. We've got 4 locations. We have Lafayette, West Lafayette, Zionsville at the Marketplace of Anson, Fishers, and we're getting ready to open Carmel next month. So it's been growing rapidly and we're able to help more and more people, and it's been very exciting.
Excellent. So you have 5 locations now already, just under your umbrella. That's great.
Yes. Yeah.
And Taylor, why don't you tell us who you are and who you're with and what you do?
Of course. My name's Taylor Trowbridge. I'm a speech language pathologist. I own Indie Speech Therapy, which is a mobile private practice. My practice specifically helps those with Parkinson's, primarily on speech and voice, also a little bit of cognition, and then swallowing as well. So that is what I do. I carry out a program called Speak Out, which was developed by the Parkinson Voice Project out of Richardson, Texas. And so I provide that service to my patients with Parkinson's.
Excellent. Stacy, tell us who you are and what you do and what your services are.
Sure. My name's Stacy Bunnis, and I'm with Clear Captions. And what we do is give away caption telephones to people who have hearing loss at no additional cost to them under a federal program that actually everybody already pays for and has been since 1990.
Excellent. Jessie.
Hi, I'm Jessie Hillock. I'm the owner of a private practice called the Memory Compass. I'm a speech language pathologist. My area of specialty is the cognitive breakdown that happens when individuals have a diagnosis of dementia or Alzheimer's. So I support both the families who are impacted by the disease, because it takes a whole village when a family is impacted. And then I also provide therapy services that are credentialed with Medicare Part B. So they're Medicare reimbursable services for the individual themselves who has the diagnosis of dementia or Alzheimer's.
Excellent. So Amber, would you tell us who you are and what you do?
Hi, I'm Amber Spears. I'm a speech language pathologist and have my own company as well, mobile private practice called Speech Therapy Connections. So I go into patients' homes and do speech therapy with them, work on voicing, speech, cognition, swallowing, pretty much any of it. I am certified in Lee Silverman voice treatment and vital stim as well for swallowing. So yeah.
Oh, very good. Amber, I see that you're here. So hi, Amy, hi, how are you? So introduce yourself and what you do. And I think you're here wearing 2 hats today, are you not?
I am. So my name is Amy Harris. I am the Community Outreach Director for Hearing Solutions of Indiana. And I also am the program coordinator for a group called the Archibald Memorial Home Foundation. And they are a nonprofit organization that helps deaf and the hard of hearing find placement, find resources, or what have you during their senior journey.
Well, excellent. Well, one thing too, we had one other panelist that was going to be on here, and then she had a personal conflict that came up that she had to deal with, and that's Jesse Hillock with Micah Huber with Lake Meadows Assisted Living. And what worked out well is that Amy is here, because Amy is the one that is starting the program, or really basically creating the program that Micah was going to talk about. So you were the coach, the trainer, the instigator, the whole bit anyway. So you can tell more about it than anyway. So that's phenomenal. So hearing and speech. Okay, so this is the Hearing and Speech Month, and I am honestly so uneducated on this area. I'm not sure if I've ever been to a hearing doctor. I probably very much should, but I don't know that I have, so I couldn't give any kind of experience with that. Don't know. I don't, so basically I'm going to be counting on you guys to help guide us through today, to let us know really what all's going on. And Dr. Judy, let's go to you. What is it how many people, are people like me that should be coming in that don't? How do we get people to understand why they need to come in?
Well, first of all, hearing loss does not discriminate. Doesn't discriminate. It affects people of all ages. I myself have actually been wearing hearing aids for over 20 years. So I started losing my hearing in my early 20s. And that's not as common as, noise-induced hearing loss, but there's a lot of things that impact people's hearing throughout the years. And there's a lot of ways people are impacted. So most people wait 7 to 10 years from the time they first know there's an issue until they actually make that appointment to come in to get a hearing test. One of the things that we provide is we do no charge consultations. So anybody at any age can make an appointment. If they're pediatrics, we do need a referral from a physician, but anybody can come and see us. And a lot of speech therapists, we get referrals from physicians, speech therapists, all different kinds of doctors, chiropractors, you name it, we get referrals and we take care of our patients. The first thing is we recommend anybody over the age of 50, and actually that age is kind of getting younger and younger as time goes on. Anybody over the age of 50 should have a baseline hearing test, just a baseline to see if there's something going on. Now, if there's a lot of comorbidities that occur also that can cause hearing loss. Diabetes, different treatments for cancer. There are medications that can cause hearing loss, certain lifestyle choices. And of course, for instance, somebody that works around a lot of noise at work every day, years ago, they know a lot more now about how to protect our hearing than they did, 20, 30, 40, 50 years ago. I see people every day that worked in factories 40, 30 years ago, and that, they're like, nobody told us to wear ear protection. But in recent years, of course, they've become a lot more strict about that. So it's helping to preserve people's hearing a lot better. But yeah, I think it should be treated like any other health issue. So one of the interesting things that I always talk about when I give presentations is the top 3 health concerns facing our senior population. Number 1 is hypertension, high blood pressure. Number 2 is arthritis. And you know what the third one is? Hearing loss. That means it is more prevalent than diabetes or cancer. So if you kind of think about that, that kind of blows my mind a little bit. But this is the 3rd most prevalent health condition for people over the age of 55 in our country and all over the world today. There's a lot of things that can be impacted by hearing loss that is not treated. So the interesting thing about hearing loss is that it's invisible. So, and it's not necessarily, it doesn't cause pain, at least not physical pain. Untreated hearing loss can be linked to depression, paranoia, frustration. It can affect your family relationships. people start withdrawing. So then the cognitive decline sets in a lot quicker, a lot more quickly than it would if you're continually getting stimulation to the brain. So that's kind of a very quick overview of some of the things I educate people about with their hearing. But all the speech therapists that are on the call tonight also can attest that, you know, lack of hearing, when you're not hearing, it affects your speech, because over time, especially in the high frequencies, that's where, you know, there's a lot of things that happen in order for us all to speak. Sometimes I'm amazed that we all can walk and talk, and all you speech therapists know what I'm talking about. There's so many things that have to happen, but also the hearing is a really important part of that as we form our words and form our speech so that we can hear ourselves. And so untreated hearing loss actually can lead to problems with speech as well as a whole lot of other things.
Well, we definitely experienced that in our family. Our oldest son had a lot of ear infections when he was little, and then his speech was really bad. And we were the only one of our friends or relatives that had kids, so we weren't around anybody's kids but him.
Mm-hmm.
So we understood him, and so we didn't really see the problem until his brother 4 years later was speaking more clearly at 2 than he was at, you know, at almost 6. And we go, okay, maybe we have an issue. And then speech therapists were able to help work with him, but they believed because he couldn't hear real well through all those ear infections that he got weird. The sounds were weird to him or something. And that's how he didn't develop that at first. But so I've experienced that. So, and I also have another thing, and you'll probably end up talking me into coming in and seeing before it's over, because I didn't realize that I had an issue until that same son 34 years ago was a baby. And I come home one night and my wife's watching a movie, and I sit down and I'm looking at her watch this movie, and I'm like, there's no sound on, you know? And so I'm going, you know, and she, oh, I'm sorry. She turns it up. Well, then I heard the guy talking, but I couldn't hear the woman, you know, so she had to turn it up again. And I'm like, so I have learned that I can hear men's voices better than I can children's and women's. And it also depends on how if they're facing me or not. I grew up on a farm on a tractor and, you know, loud rock music and whatever else. So I paid a price for that, I guess. So, but anyway. So the speech therapists, we have a litany of speech therapists here. So I'm going to get you guys involved. And I know that you guys cover different areas of it. I mean, Taylor, I know you're doing a lot with the Parkinson's, Jesse with dementia. Amber, I think, did you say you're also into the Parkinson's area as well? Or okay. So I'm going to let you guys talk a little bit about the speech side of all this, what we're getting into on that. I don't care who starts this process, what you run into, what you're seeing out there in people, how, you know, what people are experiencing that you can come in. Because I think a lot of people, until I had a speech therapist helping my uncle with swallowing, I had no idea you guys, the scope of the things you guys do. So, you know, Taylor, you want to get started here, or we kind of give us what? Okay.
Of course. So I think the biggest thing to kind of, like you mentioned, to kind of bring awareness to is just everything a speech language pathologist can help you with. We cover such a broad spectrum that it's hard to know everything that they can do. And, you know, like you said, unless you have an experience with it, you may not know that we even see adults. So what I do specifically is work with the Parkinson's community, like you spoke of, but we can also see a lot of different neurological disorders, stroke, brain tumor, dementia, like Jesse covers, you know, myasthenia gravis, Guillain-Barré, a lot of these different things. And I think the biggest thing is just advocating for yourself, because sometimes it might not be the first thing that people think of to go see a speech language pathologist, but basically anything communication or swallowing related we can help with or refer to the correct person to help with, and be a really good resource. As far as what I do with Parkinson's, like I said, I am trained in Speak Out, which essentially is a program that works on intention and being more intentional with your speech. and it can help with the clarity, volume, the rate, also cognition and swallowing are improved through this program. So that's what I do specifically. But I think the big takeaway is just that we need to be advocating for our patients and getting the word out more about what speech language pathologists do, so that people know that the resource is there and how we can help them.
Okay, and Amber, you can jump in on this one if you want to as well. But like, for instance, we just did a Parkinson's panel, I don't know, a couple weeks ago. I'm not sure when it was now, but it wasn't long ago. And in that panel, one of the things that really came out was how the speech therapy helps people to not slide in, in regressive or having the progressive thing of the disease, taking things away from them, not only in speech, but in cognitive ability, I suppose, and then also like in swallowing their pills, swallowing food, so Parkinson's is that, I know specifically has a big issue with that. So when should they start process on it? Can they gain anything back if you've lost something in the process? I mean, I guess you have like this wall that if you lost it, you can't gain anything back, or is there, where does that go from the Parkinson side of it, since you guys both deal in that?
I think they can make progress no matter what level they're at, can still improve. Obviously, the earlier that it is started, the better, but at any stage, I believe they can make some gradual gains that will improve their life overall with the speech or the swallowing, either one.
Well, I think that like one of the things that I heard in that Parkinson's panel was that Parkinson's very often is misdiagnosed or undiagnosed for many years, before they even figure out what they have. So that's why you guys are probably often coming in late, to what you would like to be, I'm assuming. So
Yes, and like Dr. Olsen said, a lot of people will wait until it's been years that they've noticed the issue before they seek help. So then we come in even later because of that reason. But like Amber said, the earlier the better for improvement. But I agree that any time that they get intervention is good. I'd rather see somebody later than never. And Parkinson's specifically, if they exercise is such a big thing for them, because Parkinson's doesn't cause the weakness, but over time, them not using their muscles correctly can cause weakness. And so the sooner we can get exercise implemented, we don't really think of voice and speech and breathing and swallowing muscles as muscles, but they are, and they need to be exercised. So the sooner we can get that exercise implemented, the better off these people do. So.
Well, very good. Well, one thing while I was on this is Indiana, from what I understand, is a state where you can reach out to a therapist of any kind, physical, whatever, without a doctor's, I don't know, referral or what have you. Is it something that so anybody could just go, hey, I want to get checked out here, I want somebody to take a look? Is that something that someone can do and get a hold of you? And do they need their doctor eventually to get them, if for instance, if they want Medicare pay for it or whatever, or is that even, I don't know, I'm just asking because I don't know.
Yeah. So, Indiana is a direct access state, so you can contact the therapist directly. So that could either be, an outpatient clinic that's connected to a hospital, or that could be providers such as the therapists here who we're mobile providers. So we go into the home. You do not have to have the doctor's order initially, but in order for the services, if you see them for more than evaluation and you have an actual plan of care where you plan on seeing them, let's say 1 to 2 times a week for a certain number of weeks, then you would have, the plan of care sent to the physician, and then the physician would sign off on that plan of care, and that plan of care would then, you would be able to get reimbursed through Medicare. For me personally, families do contact me directly, but I recommend that they do reach out to their physician before I pick them up, just because, I would rather have that relationship with physician, then just all of a sudden they get this fax of this plan of care that they need to sign, and they have no idea why their patient is seeing a therapist. But one thing too is that, usually when you go see your physician, you get this like 15-minute window of time to tell them everything that's kind of bothering you. And sometimes it's even less than that. And we think of all of like the physical ailments of, physical therapy things that bother us. But we don't always think of, is our voice as loud as it once was? Do we feel like there's something stuck in our throat when we're eating? Are we coughing when we're eating or after we're eating? Those things aren't often brought up to the physician. So then the physician isn't just going to say out of the blue, oh, you need to see a speech therapist. So it's keeping track of these things that aren't like what they used to be, bringing those things, up to your physician, and then also knowing to advocate for a speech pathologist in your area. And we, like everyone said, we work on everything from basically here up, not just speech.
Well, I think that's a good point too, and let me ask you a question, and this is for all of you, the speech therapist part of it. How well do doctors even know that what you guys do and when to bring you in? I mean, from what I'm hearing from hospice and palliative and whatever, it's like the doctors need as much education as anyone in the public does on this kind of stuff. Am I off base there? Or?
No, Jim, I think it really depends on the physician. Some are more familiar with what we and other therapists or other services can provide for their patients. But yes, I agree that it's not always, like Jesse said, it's not always brought up to the patient, but if the patient brings it up, a lot of times then a referral will result from that. But it's not something that, in my experience at least, which it just depends on the doctor again, but in my experience, it's not something that they're routinely bringing up to the patient.
So if you've got a family member or yourself and you're going, gosh, I just don't know if I'm having an issue here, if I'm having trouble swallowing my pills, if I'm whatever it is, whether they talk to their doctor or they talk to you and then have you help them with their doctor, it seems to me they need to do one of the two. I think they're better off talking to you first if they have to, just to get guidance, coaching on what to do. So Stacy, tell me, that when they call a hold of you, they've already got an issue with their hearing. So now you're going to help them, stay in communication with people as well, right?
Yes. I try to help them, aside from the phone, I try to help them get other resources that they can help them live a better quality of life if they live on their own and they can't hear. One of my questions is, would you hear the smoke detector if it went off? A lot of fire departments will provide them with a device that slips in between their mattress and box spring, and it'll vibrate the bed when the smoke detector goes off, so they're safe. I have clients who can't hear the doorbell ring, so I can point them in a direction to get a device that'll make their lights blink on and off. But we also do provide caption telephones to anyone who has hearing loss. And not everybody can afford a hearing aid. So this, at least, especially in the situation we've been in for the last year, make sure that they are able to communicate with their loved ones, especially when they're feeling alone and lonely.
So do you actually go in and meet with them, or is it kind of just here's the phone, or I mean, how does your services work?
So I actually go out into the community directly. This past year, it's been a little more difficult to meet clients. So there haven't been any health fairs or senior outreach, no lunch and learns. So actually, I've been following the food delivery trucks from like Gleaners around, and I get there a couple of hours before and I walk from car to car, introduce them to our program. If they're interested, I take their name and number and I call them later. I answer any questions. And then if they want to move forward with getting the phone, I get them on the schedule to get their phone. And depending on where they live, how far away they are from Indianapolis metro area and the donut counties, I will personally go out and install their phone for them. But we are using humans to go out and install the phone. Some of the other caption telephone companies or I don't know if they're still doing this, but at one point they were just mailing out the telephone. And as long as people are okay with us coming into their homes and we do wear masks and gloves and all of those things, we do go in and install the phone and show them how to use it.
Excellent. Amy, I'm real curious about some of the things that you're doing. I mean, yeah, I know that you're working with the hearing centers to get things going, so that's exciting. But you also have I don't know if they're two separate projects, or what are you doing with the senior livings where you're trying to get them hearing friendly, or whatever. So I'm gonna let you kind of explain that, because quite frankly, there's a lot of stuff there that I want to figure out.
It is a whole lot of stuff. So my job is to, well, one of my jobs with Archibald Group is to go out into the communities, the SNFs, local businesses, and ask if they want to be considered deaf-friendly businesses, deaf-friendly communities. And I'll just use the skilled nursing facilities and some of the assisted living facilities as an example. So, and I'll use Micah's building, Lake Meadows. Went to Lake Meadows and said, hey, I have like several deaf people who are in need of assisted living. And we want to find a facility that's open to learning sign language. We have an activity person that we provide at that building that provides the social interaction that they need with their language, which is American Sign Language. And that person comes 3 times a week. It's free to the community, so they don't have to pay for her. We pay her. And then we go into the facilities. We teach the staff sign language. We do everything that we can, and then they're able to be on our Facebook page, on our website, and they're known as a deaf-friendly community, and also hard of hearing community, because then they also need to do the things, almost the same exact things to communicate, except they're not using sign language. They may be writing, they may be talking a little louder. Or they may go see Dr. Judy and get a hearing aid to help them hear better. So those are the things that I'm doing with them. Another thing that I'm doing for Dr. Judy, and I'll go back, is I am going out into the community, and for those people who are hard of hearing, giving them the option to learn sign language. Because what happens when your hearing loss is so bad that the hearing aid isn't helping anymore? So you'll still be able to communicate. You won't feel isolated. Your family can get involved with learning sign language. And then that way, after all said and done, you're still able to communicate even though you can't hear. So my job is to open the eyes and ears of everyone out there to educate them. I do go into the hospitals and do presentations on deaf culture and explain to them the best approaches to communicating with the deaf and hard of hearing, do's and don'ts. Some doctors don't they don't go above and beyond to make sure that the deaf patient understands. They just talk to them in their language, but they don't understand that sometimes you got to make sure that the interpreter understands what's being said. So there's just like a whole lot of things that I am involved with in making sure that the deaf have the services that they need to flourish in whatever environment they're in. If they want to stay at home, I am working on partnering up with home health companies, hospice companies that want to teach their staff sign language so that those deaf people can stay at home and be independent as long as they possibly can be. And providing the same education for the hard of hearing as well there. So
wow, you've got a pretty big plate to fill. I mean, there's a lot of places that I'm sure you want to be talking to. So so do you have like a target range of the different ones you're going after, or how are you doing that?
So what I'm doing is I'm trying to hit like a long-term care on the north side, assisted living, one that has Medicaid waiver and one that is just private pay only. On the north side, and the same for the east, south, and west. Whereas before, back in the day when the Archibald Group started, they started at Miller's up in Castleton, and they had a large deaf community. At one time at Miller's, there were over 50 deaf people there. And their families wanted them to be there because then they were around other deaf people, right? And so
Right.
they can still have that social stimulation and still feel like they're part of a community. Because what happens is a lot of time when you only have one deaf person in a building, they're not part of a community anymore, and nobody talks to them in their language, and they become isolated, and they become depressed, and they go inward, and they don't talk to anybody. So it was a great program that they had back then. And then unfortunately, families as well as the community, they just kind of lost their excitement about it all. And then families started saying, well, I want them closer to my home. I don't want to drive 30-45 minutes to go see mom at the nursing home. So I'm going to pull her out and I'm going to put her in a facility closer to me. So with that being said, the plan for the Ultra group is to actually cover the whole state of Indiana. So another project that I'm working on is finding volunteers who are deaf and that wouldn't mind going to visit seniors in a nursing home or at the hospital or what have you, so that they can still get that social interaction wherever they are. So we're trying to meet the families and the deaf in their world and in their locations.
And
So
if you start adding in your home care companies and all that kind of stuff, you've got a lot on your plate. So
I do. I do.
so that's very interesting. So Dr. Judy, what is if someone's coming in, I mean, I don't know. I honestly don't know. Again, I'm telling you that I'm not. I may have been in once, but I don't remember. Okay, my mom may have brought me, or but anyway. So I don't really know what the experience is like. Maybe everyone does, but what are we looking for? Are we looking to? Is it correctable if there is problems? Is it uncorrect? I mean, is it correctable without using aids? Is it? I guess that's why I'm throwing it back to you to tell me why I need to come in.
Okay, well, you need to come in because obviously you have an issue. I've said and outed yourself, and so we'll talk about it later. But basically, anybody who, if you notice that, if you notice everybody around you is mumbling, it's probably not everybody mumbling. If you notice that you hear, like you've touched on, you hear men better than women, that's a really strong indicator of high frequency hearing loss. If you have other issues with your ears, or diabetes, those are more reasons to come in and at least get a baseline, if nothing else. So most of the time, 95% of the time, there's a hearing loss. It is typically what we call sensory neural, what people in the old days would call nerve deafness. It's not really, yes, it has to do with the hearing nerve, but at that time, doctors would say, oh, there's nothing we can do because you have nerve deafness. But that's wrong. That's exactly who we need to help. Actually, we need to help everyone we can. So there's two different types of hearing loss, and 95% of the time it is sensory neural. 5% of the time there's going to be something more medical going on, or more of what we call a conductive loss. So caused by fluid, wax, other conditions of the ear, otosclerosis, which is what I have. So there's different things that can cause hearing loss and different types of hearing loss. So the first thing is getting that baseline test, and all ages can be tested. So we have different equipment and different methods for testing children than we do adults. And so we get that baseline test, and then based on the test, we put the results on a graph, and then that graph will decide, the graph is an important part of the story, but it's part of the story. So when I meet with a patient for the first time, I'm going to take a history. I'm going to find out, what that patient has gone through. Have they had any other medical issues, or any other issues with their ears or tubes previously, or anything like that, ear pain, pressure. So part of my job as a doctor of audiology is to assess the patient and decide, does this patient need medical intervention? Because some of them will. Some of them will need to be referred to the ear, nose, and throat doctor based on what we find on the hearing test. And then, but the majority of them, it will be hearing loss, sensory neural hearing loss, and there's a large range. And luckily with today's technology is incredible. So today's technology, the hearing aids are rechargeable. They can stream anything from your phone directly to your hearing aids. Some hearing aids can connect to up to 8 different devices, including computers. It's incredible, okay? Where there's TV, you know, like the speech therapists we're talking about, there's different things that, you know, and Stacy was talking about different things that they can utilize to help them when they, you know, have these issues, have hearing problems, or when they have hearing problems. There are things that we can connect to the TV, like they're called accessories. And so that will stream everything from the TV to the person's hearing aids, and they can still carry on a conversation. The newer hearing aids, the hearing aids I'm wearing, sample the environment 500 times per second to make decisions on how to behave, how to filter the noise around you. They actually use artificial intelligence. They have a deep neural network built in. One of the other things is, and they're so sophisticated in the way they keep you connected. So the most important thing is keeping people connected to their loved ones and to their surroundings. And this helps with relationships. It helps with to decrease, you know, to slow down the cognitive decline. It helps to keep, if we keep those, we want to keep, if you don't use it, you lose it, right? So we want to keep those nerve fibers stimulated and active. Just like the speech therapists want to help people with all the muscles to help keep that everything stimulated and active and working. It's the same with the ears. And the ears, the way we hear is actually with our brain, our ears and our brain. And we need to keep that stimulation coming. So as time goes on and people lose their hearing, then the stimulation goes away. And then that furthers the cognitive decline. It also makes it more difficult for people that there's a clarity that changes. So by clarity, I don't mean mental clarity. I mean the clarity of the signal that reaches the brain can get worse and worse over time without that stimulation. So, you know, and the exciting thing too is with today's hearing aids, we're able to help people that even have just a little bit of hearing loss. So 2 people can come in with the same exact audiogram, the same results, and one person, it could be impacting greatly based on their lifestyle. Maybe they're working, maybe they're in high communication demand situations every day. Meanwhile, somebody who's more isolated at home and quiet, it's not going to be as evident to them all the time that they're having as much of an issue as they really are. So I'm really big on patient education, advocating for my patients. And the most important thing is just keeping everybody hearing as well as possible, as long as possible. And because these changes that change in the brain, they are permanent changes. And so we work to fight that. Another thing that I do as a doctor of audiology that not all people, there's a lot of people out there that sell hearing aids. You're not going to get the same care and treatment from somebody who's selling hearing aids as you are someone like me, a doctor of audiology. I went to school for 8 years. I've been doing this for 21 years. I use the hearing aids myself. And I also, you know, you can actually buy hearing aids where you buy tires. Did you know that?
No, I didn't.
So I don't know about you, but I do not recommend anybody go where you can buy tires and toilet paper to get their hearing treated or have any other medical issues treated for that matter. But one
Unless
of the
you're out of
other,
alignment.
huh?
Unless you're out of alignment, I suppose.
Well,
yes.
right. So one of the other big things that I specialize in is tinnitus. Tinnitus or tinnitus, it's called, the ringing, the buzzing in the ears, very, very common. It's actually more common than hearing loss. And so we do a lot to help people with that. And we do use hearing instruments. And a lot of doctors will tell people, oh, there's nothing that can be done. Well, they're working on very old information. And so if ladies, if you have any doctors that you work with that tell their patients, oh, there's nothing can be done, or if you heard there's nothing can be done for tinnitus, please send them my way, send them our way. We help patients every single day that have tinnitus, and it is life-changing. So we work with people with all sorts of issues, and we can see a lot of medical stuff from the hearing tests that we do. We kind of can refer. I've referred people to speech therapists, or referred them back to their physician with a note on my report, refer for speech therapy, because a lot of physicians, like you said, they're not as educated as they really should be. The general practice physicians are not as educated as they really should be when it comes to speech and hearing. And we see patients all the time that I'm like, well, aren't you in speech therapy? Well, no. Well, my doctor didn't tell me. Well, and so I'll make sure it's on the report. And sometimes I'll call the office and be like, hey, this patient needs to be referred for XYZ or speech therapy. So I'm helping in that process as well, because there is a lack of education and training amongst physicians about these auxiliary services that we all provide.
Well, just on that note, if I'm kind of picking on myself here, but if you've been used to things for forever, okay, then what's the indicators that you go, hey, for me, that one moment 30 years ago where I'm kind of going, well, that's weird, that was a moment, I will say that if I'm in a crowd, it's really hard to hear in a crowd because there's too much chaos going on around. But what are the symbols or symptoms people should be watching for?
Well, difficulty in a crowd, difficulty in a restaurant. Anybody in your house that's complaining that your TV is too loud, it's probably too loud. Also, and a lot of people, like you said, you had this event. Oh, I know some people will come in and say, oh gosh, this happened and I was so embarrassed because this person was talking and I was just smiling and nodding. I literally had a patient say, I realized I needed to come in because I was smiling and nodding and saying, oh, isn't that wonderful? And my friend told me her dog just died. Things like that there's going to be a catalyst. We had a patient yesterday come in. Her husband, unfortunately, passed away 2 weeks ago. She's devastated and she heard nothing during his funeral. She couldn't really even participate because she had untreated hearing loss. And so usually we kind of, like I said, you're not in pain. So if you're in pain, you're more likely to go to the doctor and get something taken care of. Something that's invisible and there's not a physical pain, we tend to put it off and put it off and put it off. So there typically is some sort of a catalyst that, some sort of, like you said, a moment. I could tell you hundreds of stories of patients and the moment that they realized that they needed to come in. And a lot of times it involves the spouse or a child, the adult child in their life going, come on, Dad, you're not hearing anything, and dragging them in to see me. So, we try to make it real painless and a really great experience for them. But the other reason people put it off so long is fear. Fear is a great motivator. It's also a great deterrent. Like, people are not going to come in because they're scared to come in and deal with this, and that's a big reason people wait until there is some catalyst, some moment that happens that forces them to kind of come in and kind of take stock of the fact that they really do have an issue.
Is it fear of the idea that I want to have this big clunky hearing aid? Is it fear that I'm somehow another, what is it you think that keeps people away?
Well, the fear of the cost is one thing. That's a big part of hearing aids. The fear of the whole experience and is this going to help me? Also hearing a lot of stories from friends and family that have hearing aids and don't wear. They're called the ITD hearing aids, the in the drawer hearing aids, where they're not going to help you if they're in the drawer. Those kinds of things. But it's also like I had a gal in here the other day. She's 60 and she has a real significant hearing loss, and she goes, I'm not ready for this. And because only old people wear hearing aids. And I'm like, really? Because I've been wearing them for over 20 years. Nobody sees my hearing aids unless I point them out, which of course I'm happy to point them out, but they're really tiny and they go this is my favorite style. It's a little behind the ear. You plug it in to charge at night. I mean, nobody even sees these things. And I've never seen a hearing aid that is more noticeable than a hearing loss. So there's a lot of reasons why people, but I would say fear is a big factor in why people put it off. The other thing is general primary care physicians, and I don't mean to beat up on them, but I'm going to for just a minute. They routinely, and the speech therapist on the panel tonight probably also agree, I would imagine, I don't want to speak for you, they only routinely refer about 15% of seniors for hearing testing. And it really should be something that everybody, every person over the age of 50 should have their hearing screened. And I'm guessing they should also have their speech, speech and language mechanisms screened as well. I mean, so, because as we go through life, these things get impaired, and like the muscle, and then with us, with the brain and the cognitive part. So, they don't routinely refer, when I really think that they're doing a disservice, and that patients need to have a quicker referral rate for speech and hearing.
Well,
I have a
that's
question
excellent.
for you. Oh, sorry,
ahead.
Jim.
Go
I have
ahead.
a question for you, Dr. Judy. So a lot of times I'll mention to my patients, have you seen an audiologist? Or, I think it would be a good idea for you to see an audiologist. And a lot of times they'll say, I can't afford that. So can you speak a little bit just on what the cost piece and what I can tell them about that to kind of help get them in the door?
Yes. So if somebody's referred by a physician, then Medicare covers it. So although we're not allowed to call and ask the physician for a referral unless we've done a screening and found that there's some hearing loss, and then we are able to, because otherwise it's called solicitation through Medicare. So we have to be careful. But if somebody comes in and wants to see me, we are allowed to do, and we have there is a code that we use for consultation. It's a no charge consultation for the patients. So first of all, you can tell your patients they can come see me, and there is no charge for the consultation. Now, if they require something beyond that, then there can be charges involved. But we also have a wide range of products that we will recommend and fit, and there's a large price range with that as well. And there's also financing options available. So we have people that make low monthly payments, as low as like $56 a month and I know a lot of our patients are on fixed income, so it is a thing. It's definitely a thing. I'm credentialed with all the major insurances, and so we accept a lot of the insurances. And so, the insurance can pay a portion. We accept low monthly payments. And so there's a wide variety of options depending on what their needs are, what their lifestyle choices are, what they're looking for, what their goals are, that kind of a thing. So you can let them know that they can make an appointment we have two other doctors that do a great job, Dr. Rudy and Dr. Ryan, and they're down there in the Zionsville, Carmel, Rudy's in Carmel and Fishers and Zionsville, and Dr. Ryan's in Zionsville, and I'm in Zionsville too. So they can come see us, and there's no charge for that initial consultation, and then we'll assess everything and then go from there. But we work with patients of all lifestyles and all budget needs.
Thank you.
You're welcome.
Great.
Thank you.
Well, I'm going to pick on Jesse for just a second, because you do a different thing. Yours is dealing with speech and helping with cognitive ability. And I think other than, people have been on our memory care panels have heard this from you, but this is a speech panel. So people may not have heard how that connects. So tell us a little bit about why it's so important to be able to keep that speech going and deal with all that as well in the cognitive world.
So I worked in skilled nursing before starting my private practice. And in a skilled nursing setting, people do not realize that if your loved one admits to skilled nursing, whether it's for assisted living or memory care or long-term care, or whether they admit because maybe they've broken their hip and they're there for rehab, anytime someone is demonstrating difficulty with memory, problem solving, safety, are they remembering to lock their brakes on their rollator? Are they remembering to lock their brakes in their wheelchair? Do you think they're going to have difficulty with medication management, financial management? Are they having word finding difficulties? All those things you get referred to a speech language pathologist. So we don't just study, I think people hear the word speech and they think that's it, that's all we do. We just help people with their expressive communication or the receptive communication following a stroke. That's what I hear a lot of times in the adult world. So you would walk into the room and family would say, my loved one's speaking just fine, we don't need you. But there's so much higher cognitive level components of our language. And I just really love working with the memory patients, patients who are experiencing memory loss. And, I feel like our scope of practice is so broad, but it's okay to be focused on just one area that you're really good at. And memory is my one area that I just absolutely love. And there's different physicians out there that specialize in different things. So it's just the same. You can have speech pathologists, physical therapists, occupational therapists that really specialize in one particular area. But I just felt like, people weren't needing, well, they were needing me, but they didn't know about me until they were, admitting to a skilled nursing facility for either increased care, in their living environment or for rehab, that I felt like there's this missing piece. Families were saying that their physician or their primary care physician or the neurologist would just say, see you back in a year, after maybe receiving a diagnosis of dementia. They were told about some support groups in the area, but physicians did not have any idea, at least in my experience starting out, that we don't just work on the actual voicing component, the actual speaking component. We work on following directions, sequencing, problem solving, safety, all of those things so that people can age in place in their home. So that's why I wanted to start my practice and try to meet people where they are. I have some families where it is early stage, and that's wonderful. And then I have some families where they haven't found me until they're, more in the severe later stages. So it really doesn't matter where they are in their disease progression. This type of therapy is not going to improve your loved one's function. We're trying to maintain the skills that they have to enhance their quality of life. And we're also trying to teach the family the tools to decrease the overwhelm that they have experienced, as being a care partner to their loved one who has memory loss. So we support both the individual with the diagnosis and also the family. Your doctor, when you go see your doctor treats the patient, but there's another patient there, and it's all that family who's also been impacted by the disease. So I have really set up this kind of hybrid style practice of supporting the family through dementia family coaching services, and then also supporting the individual who has the dementia diagnosis with actual Medicare reimbursable therapy.
Well, I say, as I'm listening to this panel in general, and we do these panels like every other week. We have a different panel, different topic. And one of the things that I'm realizing as a general thing that I don't think people think about is we have a tendency to go to our doctors and we kind of just let them tell us what to do next, and we don't think that of anything beyond that. And at one of the panels I was doing, someone was telling me, in fact, it may have been you, I don't even know who it was, but the average time someone's with their doctor is 7 minutes of actual face-to-face time with their doctor. And in that, and I just did my annual physical on Friday. So it's one of those things, you're trying to go through all these things, you're in and out, you're not there very long. And it's just, what have you, there's not a lot of interaction as far as that goes, so you guys don't come up. Okay, as I think is what's basically happening. Okay. And unless you specifically ask about it, you don't get it. And I think that's the same thing with palliative and with hospice and I can kind of go down a whole big long list of things, specialties that don't get exposed because you're waiting for your doctor to tell you to do it, and it's not on their radar, so that's why this is important. That's why I'm trying to get you guys your voice out here to tell this story, so we can figure out how to let people know that you've got to take control of this. You've got to be the one that's making a phone call going, hey, I need help. And maybe, Jesse, I know you say you prefer them to go talk to their doctor first, but maybe they need to talk to you to get coaching on how to talk to their doctor, so that the doctor doesn't blow them off. My own experience, and I love my doctor, my GP. He's a nerdy little guy that likes to ask a lot of questions. He's very thoughtful. I like him. But I was his very first COVID patient back, in spring of 2020. And then I have a friend who's a doctor who was also a COVID research scientist who was feeding me information that I was asking my doctor, and he thought I was nuts because he'd never heard any of this stuff before. Okay. Well, I'm teaching my doctor. So I think that a lot of us need to teach our doctors. We need to teach them that they need to talk, why we need to talk to a speech pathologist, why we need to talk to a hearing doctor, why we need to talk to, whatever, and I think that's the point I'm trying to make with a lot of these panels, of getting your voices heard. So it's as it always is, we're running out of time on our thing here again. Is there something you've been wanting to say to people, going, for crying out loud, I want you to hear this one thing, about your topic? I'll let any of you go that just want to try to get your voice heard one time. If you had the opportunity to grab someone by the lapels that you're walking down the street and go, would you please listen? That's about this topic. So go ahead. I'll let you go start. Whoever wants to go.
I will say something. Growing up with deaf parents, all my life, all I've known is hearing deaf, hearing deaf, hearing deaf. And I cannot tell you how important it is to get your hearing tested. My husband was telling me, babe, you're not hearing me. I'm saying things to you and you're not hearing me. And I'm like, babe, I don't have a problem. And so I started looking online and I saw, oh my gosh, at the age of 50, and I turned 50 this weekend, you should get a hearing test. So I went to our office and I said, it's either me or my husband, but I need to know if I have hearing loss. And I do not, but I got to go home and tell my husband it was him. So that was great. But all I can say is your hearing is everything. My dad sometimes will say he just wishes that one time he could hear what my voice sounds like, and so for those people who can hear, their last wishes are going to be I wish I could still hear what that voice sounds like. So, get your hearing tested. I mean, it's a free consultations. I mean, it doesn't hurt to walk in the door and at least know where you are with your hearing. What you do after that is between you and the doctor, but just get your hearing checked, period. And, if you do see somebody who's struggling out in the community, whether they're deaf or hard of hearing, try to help them out a little bit if you see that it's a real struggle, because they will appreciate that. And then I will add this too. Deaf people have been dealing with hearing people far longer than we've been dealing with them. So any type of communication, even if all you do is finger spell, a 16-page conversation and you're just finger spelling, they're going to appreciate your efforts, and just I don't know, just be kind to those who can't hear. And then, again, make sure you're taking care of your hearing.
Thank you. That's great. Anybody else have anything you want to get out? Well, let me do something real quick. I'm going to do a screen share real quick to show what's coming up. So we like to do these, it's always trying to figure out how do we put out this information for people. So on Life's Copilot, you can always go to events. And if my web's working here. So this is the one we just did. One of our members has got an event coming up on a donation thing for Crohn's. And then we've got on June 10th, we're going to be doing geriatric care managers, a panel like this. Then one of our panels has a fundraiser coming up on the 12th. So then we go back to the 22nd. We're doing one on Alzheimer's and awareness on there. So, well, I just want to thank our panelists. I think I thought this was phenomenal. I hope you guys enjoyed it. This video will go, it's on Life's Copilot's Facebook page now. It will go on there again later. It'll also go on our website under resources, under the video library. It will also go out in a, like it'll be on LinkedIn and what have you. And I'm going to give a copy to each one of our panelists that you guys can use however you want to do. So thank you so much for sharing your evening with us. I really appreciate it. So thank you for coming.
Thank you,
Jen.
Thank you.
See y'all. Bye-bye.
Thank you.
Bye.
Bye.
Bye.